Dr. Zayed. Thank you for being here. So I wanted to ask you about, the regenerative and functional medicine. Now, I know you've done extensive medical training in medical school and learned like conventional medical practices, but regenerative and functional medicine is a little bit more non-conventional. Tell me what that is and how our listeners could really benefit from that kind of medicine.
Functional and regenerative medicine is basically, in simple words, the medicine of the 21st century. It is individualized medicine. Think of regular conventional medicine as measure, basically symptomatic, meaning that if you have high blood pressure, we'll give you a pill to treat your high blood pressure. If you have diabetes, we'll give you a pill to treat your diabetes. We don't know exactly why, a lot of times, not all the time, a lot of times we don't know why, it's working, but we're treating the symptom. We're not treating the root of the disease. And this is when regenerative and functional medicine comes handy. Secondly, it does come handy because it is individualized. Conventional medicine think of it as the mass treatment. One pill fits it all. From my standpoint, that's not what I believe in. Every person is different. It's not a cookbook. Medicine is not a cookbook. We're all made in all sorts of shapes and kinds and genetic makeups, and that's the difference.
That makes a lot of sense. I can completely understand how you can't give one pill to everybody and expect the same result. But tell me, is regenerative and functional medicine the same as anti-aging? What is anti-aging medicine?
Well, anti-aging medicine is practically, you can think of it as the same as functional and regenerative medicine, but it is a layman term. To be quite honest, there's nothing called anti-aging. We cannot stop aging, but we do, and we can make you age gracefully. Okay? Let me start off by saying what in my opinion, and a lot of scientists' opinion, what is aging? Aging is basically a combination of hormonal imbalances exaggerated by nutritional deficiencies. And the combination of both is not really good. This is how we age. It can cause inflammation. We do age by inflammation internally, that is. And what I do believe in, with just a little bit of hormonal, if needed, hormonal therapies, together with a lot of nutritional, supplementation, and for sure lifestyle changes, we can achieve great results, and sometimes it even exceeds patients' expectations with just simple things. All of this under strict medical supervision and strict laboratory follow-up.
That's a very interesting way to look at it. I completely understand. Let me ask you another question. We get a lot of people, stressed out, they work too much, and then they spend their whole day like drinking coffee and Red Bull and 5-hour energy just to get through the day. What kind of treatment can you do to help these people that are just coming exhausted all the time?
Let's face it, this is a very interesting question, because we all are stressed, okay? We cannot get off our cell phones. People don't realize that whatever you put in your body, it could stress your body if you're not eating well. It's not. People think of stress, I'm working hard, and a lot of toxins in the air. Yeah, that's just not right. This answers part of it, but not the whole answer. The whole answer includes how you sleep, how you rest, how you train. Some people think that if they work out well, that's it. Well, guess what? They can overtrain themselves and put even more stress on their body and lose a lot of nutrients in the process that are key to their harmony. I really think of the body, the whole body, it's a harmony of hormones and nutrients. Everything has to work perfectly together. If one is off, well, guess what? Alarm is going to go off, and it's not going to be good. And at this office, I do ask a lot of questions about stress. My bottom line is to try to find the root of the problem. That's number one. That usually happens through extensive questioning and a lot of blood work. And then afterward, the good news is a lot of supplementation, herbs and vitamins would definitely help, and people would feel a lot better, get their energy back, their edge back, sleeping better, and feel amazing.
That's great. I vote for getting people off of caffeine ASAP too. Let me ask you another question about IBS. This is a buzzword I hear about all the time, irritable bowel syndrome. It seems like everybody and their mother has this condition. What is it exactly? How can you treat it? And how could we help people? Because all I hear about is like people are taking prescriptions for these things.
That's a great question. Let me start off by saying what IBS is. Syndrome, like you said. It's not a defined disease. It is a syndrome. It's a few symptoms, and we pack them up together and say, okay, you have IBS, take this pill. Sometimes it works, a lot of times it doesn't. I like to explain to people this way, okay? If a ship is sinking, okay, and sending some more signs, if you don't know how to read it, it's the same thing as your body. Your give some symptoms as red lights. If you don't know how to read those red lights, you won't be able to help those patients. And by helping those patients, that's what I do here. Try to get to the root of the problem, because your body is not meant to be in IBS. I mean, that's not normal. I'm using IBS because that was the question, but there's a lot of other symptomatology that the same rule applied to. And it's not meant to be in IBS. It's not meant to have this, and that symptoms. That's not normal. And by implementing and following the treatment plan that I personally prescribe for you, okay, it's individualized medicine. Remember that. You will feel great. You have less symptoms. You'll have more of a social life, better sleep, less bloating after food, and feeling amazing.
Thank you, Dr. Zayed, for providing our patients with this really valuable information. If you want to take advantage of any of these treatments and make an appointment with Dr. Zayed, please call the number on your screen.